Hello and welcome to a new Deep Dive. This Deep Dive is brought to you by the Association of Workers' Compensation Boards of Canada, also known as the AWCBC. Today, we're digging into something really crucial, the Federal Framework on Post-Traumatic Stress Disorder, specifically the Report to Parliament 2025. Now, this isn't just another dense government report. It's more like a snapshot over the last 5 years. It shows us national trends, how federal policy has been shifting, and really importantly, best practices, especially for workers' compensation boards, WCBs, and healthcare folks across Canada. So our mission today, unpack the key insights, get a handle on the changing landscape of occupational PTSD, and see what the path forward looks like according to this report. PTSD, for a long time, people mainly associate it with the military, right? But this report really makes it clear it's a major occupational health issue right here, right now. We're seeing more cases and definitely more compensation claims. So why is it becoming such a pressing concern?
Well, the scale is it's significant. If you look nationally, about 8% of Canadian adults deal with moderate to severe PTSD symptoms each year, but it gets more specific. For certain groups, it's much higher. Think women, young adults, and especially our frontline workers. The rates can be around 11% compared to maybe 7% in the general workforce.
11%, wow.
Yeah, and for first responders, people running into dangerous situations, the risk is really stark. We expect somewhere between 12% and 23% of them to develop PTSD in their careers. And consider this, 63% of Canadian adults have gone through at least one traumatic event. So it paints a picture of a widespread challenge that's really impacting the workplace now.
That's sobering. 63% experiencing trauma. How does this translate into practical challenges for the compensation systems,
The numbers really tell the story there. PTSD-related lost time claims, they jumped almost 50% between 2018 and 2022.
50%? That's huge.
It is. From about 2,200 claims to around 3,300. So it's this sustained pressure. Take British Columbia, for example. After they brought in coverage, psychological claims went from roughly 4,500 in 2019 up to 6,800 in 2023.
Okay.
And by 2022, PTSD alone made up 45% of all mental injury lost time claims nationally. That's 3,291 accepted cases. Just a decade earlier, it was only around 1,200.
So more recognition, more claims being filed and accepted.
Exactly. It shows the problem's growing, but also that the system is perhaps responding more.
Right. So beyond just the volume, what does this complexity mean day to day? For the healthcare system, for the WCBs, what does that systemic pressure actually look like on the ground?
It's a big question. These PTSD claims, they're generally way more complex than, say, a physical injury, and often costlier, too. Look at Ontario's WSIB. Their costs for work-related mental disorders. They shot up 38% in 2022 alone, hitting $28.1 million.
$28 million. Just in Ontario.
Just in Ontario for those claims. And a major bottleneck is just getting people timely help. Access to mental health care, especially specialized trauma care, it's a real struggle. We also see disparities in claim approvals. You mentioned BC paramedics might see an 84% approval rate there.
Okay.
But for workers without presumptive coverage, maybe like teachers, it could be closer to 50%. That difference sparks a lot of debate.
Right. You mentioned presumptive coverage. Can you just quickly unpack that? What does it mean and why is it debated?
Sure. Presumptive coverage basically means for certain jobs deemed high-risk, firefighters, police, paramedics, if they develop PTSD, it's presumed to be linked to their work. They don't have to pinpoint one specific event or prove causation in the same way. It just smooths out the claims process immensely.
It removes the barrier.
Exactly. The debate is whether that presumption should apply more broadly to other jobs with significant trauma exposure like nurses or correctional officers, maybe even teachers, to ensure fair access to support. It's about recognizing the job's inherent risks.
That makes a lot of sense. Okay, so given this growing complex issue, what has the federal government actually been doing? Tell us about this federal framework, the 2025 plan.
Right. The federal framework, it's essentially Canada's 5-year national strategy led by the Public Health Agency of Canada. Quite comprehensive, really. It focused on 4 main priority areas.
Okay, what are they?
First was improving data and surveillance. Pretty fundamental. You need good data to understand the problem, right?
Absolutely. Baseline data is key.
Second, Best practices in diagnosis and treatment. They funded McMaster University to do a national scan of clinical guidelines, basically. What's the best science telling us about treating PTSD? And they're working on a central place, a repository for these best practices. The end goal is a sort of national hub for resources.
Making the best knowledge accessible. Good. What about awareness and training?
That's the third area. Education and awareness. Things like publishing a national PTSD glossary, launching the Words Matter campaign to fight stigma. But the really big piece here was a $50 million investment in 14 innovation projects.
$50 million. Wow, what did those projects do?
They delivered things like peer support tools, trauma training, directly reaching over 150,000 frontline and essential workers, so real on-the-ground impact. Although the report does mention there isn't quite a national coordinated strategy yet for all these educational bits and pieces.
Interesting. So lots happening, but maybe needing more connection. What was the fourth area?
Collaboration and partnerships. Super important. PHAC got a federal coordinating committee going, bringing together 17 different government departments. This led to things like the National Action Plan on Post-Traumatic Stress Injuries, or PTSI, with $31.7 million in funding. We've also seen new therapy programs pop up, like PSPNet for public safety personnel, and long-term studies like with the RCMP to track impacts over time.
So connecting the dots within government.
Yes, and the report really pushes for extending that collaboration outwards to provinces, WCBs, healthcare systems, true integration.
Okay, a lot of groundwork laid. Now, let's pivot back to the broader impact, this rise in PTSD cases.
Yeah.
How is it fundamentally changing things for workers' comp and healthcare? How are they adapting?
It's forcing a real shift. For the compensation systems, WCBs are having to look beyond the old physical injury models. Many are creating specialized mental health units, adapting policies like that presumptive legislation we discussed. It's not just the cost, but the duration and complexity of these claims.
Like healthcare?
For healthcare systems, it's really highlighting some critical gaps. Shortages of trauma specialists, long wait times, especially if you're not in a major city. It just screams for earlier intervention.
Because what else?
Now, there's workplace reintegration. Getting someone back to work safely after PTSD, it's tricky. Needs personalized plans, maybe different duties, lots of coordination. Some provinces are developing toolkits, using occupational therapists more. It's complex.
I can imagine.
And we can't forget secondary trauma and burnout, the toll on healthcare workers, colleagues, managers supporting those with PTSD. Organizations need internal mental health strategies too.
Good point. Protecting the protectors, so to speak.
Exactly. And finally, the report flags emerging needs in trauma care. New therapies like EMDR, that's eye movement desensitization and reprocessing, or even virtual reality therapy are coming into play. And always, always the focus on prevention and early intervention. Resilience training, mental health check-ins, trying to get ahead of it.
Okay, that's a really comprehensive overview of the challenges. So given all that, what are the concrete takeaways, the recommended practices from the report for WCBs and healthcare providers? What should they be doing now?
The report lays out some clear strategies. First, strengthening prevention and early intervention. This means things like promoting psychologically safer workplaces. Canada has the CSA Z1003 standard for that, a great framework. It also means pushing for broader presumptive PTSD coverage, having solid critical incident response protocols, getting support in place fast, like within 24 to 72 hours, which BC and Alberta aim for, and promoting resilience training programs like Resilient Minds or Road to Mental Readiness.
Prevention first. Makes sense.
What's next? Second, improve access to specialized treatment. This is about dedicated claims teams for mental health, ensuring rapid access to counseling, and funding evidence-based therapies properly. Things like multidisciplinary care models. Alberta's TPI model is a good example, bringing different specialists together. Also crucial is culturally competent care and making sure clinicians get ongoing training in trauma.
Right, getting the right help quickly and appropriately, and return to work. That's number 3. Support safe and sustainable return to work. This means individualized plans, maybe reduced hours, different tasks, a quieter space. Having RTW navigators like they do in Nova Scotia can be really helpful, using gradual exposure therapy for roles linked to the trauma. And importantly, regular check-ins to monitor progress and adjust the plan.
So, very tailored and supportive.
Exactly. And the final recommendation area is foster collaboration and continuous learning. We need ways for national collaboration, maybe that national PTSD knowledge hub they mentioned, streamlining processes, think digital tools, faster claims. Bringing in peer and family support is huge too, and constantly tracking outcomes to see what's working and what needs tweaking, always improving.
Okay, so as we wrap up this deep dive, it's crystal clear. PTSD among our frontline and essential workers. It's not a temporary blip, it's a major public health issue, a major labor issue, and it's here to stay. Absolutely. And while it is a serious challenge, the report also shows Canada is taking it seriously. There's a real commitment there. I think the final thought, the provocation, is that this is truly a shared responsibility. It's not just on the government or just on WCBs or just employers. It takes everyone. Policymakers, compensation boards, employers, unions, clinicians, community partners, all pulling in the same direction. The goal has to be consistent investment in care that works, breaking down the stigma that still hangs around mental injury, and really building that national collaboration. Because helping every worker who needs it, that doesn't just help them. It makes our whole society stronger.
For more information, check out the article PTSD in Canada: Trends, Federal Framework, and Implications for Workers' Compensation, available on the AWCBC website.